The average American is actually ingesting 5 grams a week of microplastics. That's the size of a credit card.
When you eat that credit card every week, those microplastics do not just stay in the gut. They get into the body and they even can get into the brain. And then also these microplastics really are destructive in terms of hormonal balance and being regular, or even things like fertility on both sides for men and women. There is some research that's showing different changes in sexuality in even like genitalia when babies come out that are higher in microplastics.
Do not heat your plastic containers. If possible, get rid of the plastic containers and use glass.
Watch out for chewing gum. It turns out chewing gum has a lot of microplastics in it. And yoga pants, ladies, and I love to live in my yoga pants too, but we need to start looking for fabrics that don't contain microplastics. Those better brands will talk to you about that. Welcome to Rethink My Health podcast, where each week we come from our studios in Atlanta, Georgia, talking about chronic disease, health matters that matter most to you, your family, your loved ones. And as I say time and time again, they do matter to us, the research scientists, the practitioners, the physicians in the trenches, day in, day out, looking for answers, finding out the causes, root cause, and communicating that with practitioners that can help you with patients, family, and loved ones. We've been going through a whole series for the past several months talking about certain chronic diseases, whether it's going to be a cognitive issue. We interviewed Dr. Bredesen on root causes about dementia, Alzheimer's. Some amazing discoveries are on the forefront, and there is hope for even advanced diseases. I call these advanced chronic diseases, but getting to the root cause is not only looking at these diseases, but going even one step further. Cardiovascular disease, all-time high. Autoimmunity, all-time high. Cancers, all-time high. We're seeing patients as young as in their mid-20s that are getting these aggressive super cancers we've not seen before. So we can ask ourselves, why? There's many reasons why. Some doctors are going to talk about genetics. Some doctors are going to be talking about aging population. Some are going to be discussing about nutritional deficiencies and toxicity. We're going to focus today on something called toxicity. We're going to tackle something called microplastics. I know this is hard to believe, but the average American, not even the world right now, we're just going to talk about the United States, although this is prevalent across the world. The average American is actually ingesting 5 grams a week of microplastics. That's the size of a credit card. I know it's hard to believe. You're literally ingesting a credit card. Yes.
Okay. Now, that's a bad way to get rid of a credit card, but that's a different conversation that maybe Dave Ramsey wants to come on a show and talk about. But this is all seriousness. The goal here is to educate and to simplify. How is this happening? We talk about just water bottles and different things. Believe it or not, it's in the air when you breathe it. So, Dr. Burdett,
Yes.
you have been an expert on naturopathic medicine, detoxification, studying epidemiology and testing and diagnostics. And by the way, this is Dr. Cheryl Burdett. I'm Dr. Gez Agolli, one of the managing directors of Progressive Medical, researcher, functional practitioner, and your host for Rethink My Health. Rethink My Health is here to educate you, not to replace advice from your medical doctor. This is based on education, hopefully inspiring you to galvanize you to take action about your health. Dr. Burdett.
Yes.
Microplastics. Big problem. When did this actually become on your radar screen? When did you actually decide to even look into it? Because, a lot of Americans have heard of it, especially in the last couple of years, But I know you've been talking about this for years. What prompted you to do the research?
And I think we're going to hear more and more about it. For example, there's a special that was just released on Netflix about the impact of microplastics. And so, and I think that while I've been thinking about it for a number of years, I probably had a tendency, like a lot of Americans, to think, well, and even where I sit, well, what can we do about it? So the presumption that everybody's exposed, and if everybody's exposed, is it really a unique cause of disease? And, just kind of get stuck in this, a bit of doom and gloom. If we know, for example, when there is a newborn baby, we can find close to 2,000 chemicals already in the umbilical cord before they even make it onto planet Earth. So there's a lot of oh, well, I guess that's just the way it is, and what can I do about it? But fortunately, there is a lot that we can do about it. And so initially, we heard about microplastics and forever chemicals. And when you hear a name like forever chemicals, it makes you think just that once they're in you for forever. However, that's not the case. We're innovative. Human beings are able to figure things out. And so, but through large agricultural and industrial phenomenons, they're looking for ways to get rid of microplastics. And so they started to focus in on some mechanisms that now we're utilizing in human care and in biology. And so it does turn out there are things that we can do to get these microplastics out. And that's really good, because even though we're all exposed, it affects some people more than others. And so what we're seeing in the research is that it's highly tied to autoimmunity. These microplastics, when you eat that credit card every week, those microplastics do not just stay in the gut. They get into the body, and they even can get into the brain. They cross what's called the blood-brain barrier, which we generally think of as keeping things out. So we see high deposits in the brain. We see that they mess up the gut and our microbiome and make the gut more permeable. We'll talk about that. And then also these microplastics really are destructive in terms of hormonal balance and being regular, or even things like fertility on both sides for men and women. And so, yes, they're disruptive, and yes, they're ubiquitous, but they affect some people more, and there are things that we can do about it.
Let's pause for a second on that, some people more. We'll talk about that. That's got a lot to do with detoxification pathways, which we're going to address on this podcast. Fascinating that some of the research is showing almost 110,000 nanoparticles to up to 300,000 nanoparticles in just one bottle of water. But it's not only the bottled water, it's actually now in our air. Mm-hmm. And it's due to all kinds of industrial pollutants. And some of the research is actually leaning towards, as you mentioned, crossing the blood-brain barrier. It's been detected in human placenta, as you mentioned, lungs, bloodstream. It's widespread exposure. And really one of the major issues that we're seeing right now is that studies are showing that it's affecting the gut microbiome, which is probably one of the main culprits now, besides infections, affecting those tight junctions. So now we can talk about this for leaky gut. When we started talking about leaky gut 25 years ago, we never really thought about that. It was really Roundup, which is our next conversation. We're going to be talking also about glyphosate and some of the ramifications on that. But I want to stick with the microplastics. Diagnostically speaking, I know that we're kind of in the infancy right now. How do you even know if microplastics are affecting you? Are there any testing out there?
Yes, there is, but it's limited at the moment. And so many times we're going to assume there might be a level of microplastic based on what's going on in your body. So for example, we see high levels of microplastics related to something called irritable bowel disease. And this is a group of conditions like celiac or Crohn's or colitis, often thought of as autoimmune conditions, and they are, and microplastics can be a trigger. But like you mentioned, those microplastics are so hard on our natural flora, the things that keep our GI tract from being inflamed, that we can really kind of assume with certain pathologies and certain conditions that we should think about microplastics. Now, there is starting to be some research out there. There is starting to be some laboratory science around looking at levels. One of the pioneering labs labs is over in Europe at the moment, and we are working with them here stateside at Precision Point Diagnostics, working on a relationship to bring some of this testing more cutting edge, looking at our own diagnostic solutions. Just had the excitement of ordering supplies to build new tests. So literally trying to figure out how to buy microplastic or glyphosate. And so you buy these from different scientific industries. And then we are starting testing to develop looking at these because it's so necessary and it can affect so many things. So when those microplastics get to your gut lining, one of the things they do is they kill off your good, healthy, normal flora. And you've read about that. You've read about probiotics. You knew that that would be a good thing to try. You were having more maybe abdominal pain or diarrhea or constipation, or you got this diagnosis. And so you thought you read correctly that a probiotic could be helpful here. And you tried it and you didn't see any difference. Or here at Progressive, we have the ability to measure the flora in your GI tract, to look at, we know that there are more flora, there's more bacteria in the gut than there are stars in the Milky Way. And so we have the capability of being able to measure that at Progressive and tell our patients, do you have the right level of good, healthy, normal flora that reduces conditions like fatigue, like cardiovascular disease, all starting in the gut, or even these gut-based conditions that I mentioned, and to see if it's there. So now, historically, if we didn't see the good, normal flora that should be there, we often thought, oh, there must be a pathogen, there must be a bad guy, there must be bad bacteria that's competing with it, or a parasite or yeast. And all of those things can be true, and they do show up on stool testing. But what we would notice is that sometimes there's no bad guy, but yet your good, healthy flora is not there. And then we try to help people with recovery with that. And most of the time that works, but sometimes those levels are just not changing like we would expect. So it might not be a bad guy. It might not be a parasite or yeast or bad bacteria, but it could be these microplastics day in, day out. And so in our patients where we see their microbiome just won't recover, they're continuing to have these GI symptoms, we're automatically thinking, okay, there must be a microplastic component. And so we're one of the first to introduce solutions to microplastics. We call it microplastic remediate. And so, yes, this is a good thing for anybody to do from a prevention front, but also can make a real difference in terms of slowing down pathology. When we think about these conditions in the gut, generally, or we think about an autoimmune condition, it's the confusion of your immune system. It's reacting, it's inflammatory when it shouldn't be. And if it's not a bug causing that, other things cause that, and toxins are a good example.
Yeah, typically you're 100% right. When we were looking at patients' root cause with gut dysbiosis or leaky gut syndrome, which is either caused from a delayed sensitivity or typically it's some kind of infection that's affecting the tight junctions. We never really thought about microplastics 6 years ago at all.
Not at all.
You would treat the infection, patient would be on a rotation diet, they'd be on some pre-probiotics, certain enzymes. Enzymes are very, very important. Using certain peptides, helping that gut lining, and the patients off and running, and they report back 30, 60, 90 days completely recovered, life restored, vitality, less inflammation. Now what we're seeing is that in addition to infections, okay, because I've talked about this before, toxicity has always been on the forefront of our mind as integrative naturopathic functional practitioners. This is foundational, looking at detoxification and toxicity. Conventional doctors are starting to realize that now, but they really haven't been focusing on that as well. They talk about toxicology, which is important. You learn that in medical school, but they don't really do much about it, right? There's certain chelators that they possibly use as well, but we're talking something a little more deeper, looking at how to detoxify the body at the cellular level, which is really the key, the cellular level. But this brings on a brand new problem. And we need more research. We need more data. It's an infancy stage. Our goal today at Rethink My Health is to rethink toxicity. Toxicity is all-time high. According to the Environmental Protection Agency, that they put out these reports every year, well over several billion pounds of chemicals. Each year it changes between 3 to 4, some even much higher than that. That's just in the United States. That's in the air that we breathe, that's in the water that we drink. And that's why we encourage all of you out there to consider getting a whole house filtration system. I know let's say may sound extreme. Water municipalities try to do the best job they possibly can. They just don't have the resources to get these chemicals out. And honestly, we're not even 100% sure if some of these filters now are even getting microplastics out.
True.
No one's really measured that. So I'm going to encourage all the manufacturers out there with water treatment that they start researching microplastics as well. But the point I'm trying to make here is that we've not been thinking about this up until recently. Dr. Burdett's been on the forefront. She's been working also with a manufacturer of supplements called KHS, Kingdom Health Sciences, and they're putting out products as well that address microplastics. And we're going to get into glyphosate in just a second, because glyphosate is actually one of the major problems right now as well when it comes to affecting human health. There's been a plethora of lawsuits against Monsanto that's recently been purchased by Bayer. Wow, they must be saying, why did I even buy that company? But that's a different conversation altogether. And specifically about cancer, we're seeing a high incidence of non-lymphoma Hodgkin's, and they're attributing that to individuals using Roundup or other problems with glyphosate. We're going to talk about that herbicide in a second, because we think that's also another thing that needs to be addressed and have a detoxification pathway. But our focus at Rethink My Health, besides education, is working with practitioners all over the country, training them. And they all talk about leaky gut. They all talk about inflammation. But no one's really said, oh my gosh, we got to check for microplastics. And I think this is going to be a big deal and a game changer. So let's move on now, before I get into the herbicide glyphosate treatment-wise. What have you seen so far? Because, typically, with over 30 years experience myself, I feel very confident when somebody talks about heavy metals. I feel very confident when somebody talks about co-infections. I feel very confident about nutritional deficiencies and balancing out hormones naturally. When it comes to glyphosate, when it comes to microplastics, I'm still like, okay, gee, what's really out there? What can bind there? So what have you found in your research that really can possibly eliminate these?
Yeah, so I don't know if our listener knows, but they are lucky to have Progressive Medical in their backyard here in Atlanta. And the reason for that is we're one of the largest integrative clinics in the Southeast, really in the United States. And because of that, many people come to us when they want to do a research study, when they want to look at a new ingredient, when they want to look at something in the integrative space. And they know that we have familiarity with running these clinical trials to really help be data-driven. Because what we want to deliver to the community at large and our patients is something that is the most evidence-based possible. And so right off the bat, some things that are already surrounding us at Progressive Medical, for example, the IQ air filters that we use at Progressive Medical, high-level air filter. If you need help getting something like that from your home, reach out to us at Progressive NutriCare. We can help you. But those actually have some data that they're pulling microplastics out of the air. I was just reading that last night. So we're already set up here at Progressive to minimize your exposure the minute you walk in the door, but we've got to keep that going. So the next thing is working with something called Microplastics Remediate, like you mentioned, from KHS, and they're really one of the first to introduce a solution to this area. So part of the solution, again, comes from what we know about our own microbiome, that good, healthy flora. And so it turns out in the industrial world as well as in the medical world, they're looking at healthy flora, things like Saccharomyces, because they actually make enzymes that appear to degrade microplastics. So in our formula that is called microplastics, one of the first ingredients that you see is this a specific species of Saccharomyces that makes an enzyme that degrades microplastics. So this is really revolutionary. It's not an area people have looked at before. Many times when we think about detox, of course, we're thinking about things that push the liver and and help the liver to clear things. And that's absolutely still something we want to think about, but harnessing the power of nature right down to this type of, it's actually a yeast, Saccharomyces, and realizing that it creates these enzymes that break microplastics down. They're working on, can they grow enough of this to even put in the ocean to help clear up water in that capacity? But in the meantime, we can take it as a capsule to get out of our body. The second thing is combining that with other good flora that's unique. So something called a Bacillus subtilis, but you want a very specific one, AB22. And so talk to us over here at Progressive NutriCare if you're looking for that, because that AB22, that Bacillus subtilis, is, yes, a probiotic, but different than other bugs out there. If we looked at it under a microscope, you would see it's bigger and it's more robust. And part of that means it has more DNA. And because of that, it's putting out various peptides. And so I don't know if you've kind of been in the integrative space, if you're following what's going on, peptides are highly sexy right now. And we're learning a lot about them. And many times you're injecting various peptides for immune function or for cognitive decline or to build gut lining or for all kinds of potential in the body. But peptides are something that we make internally, but also bacteria makes as well. So this Bacillus subtilis makes a peptide that we absorb that helps us with clearing these microplastics. And so these things that we thought, there's really nothing that can be done about it. Actually, they're clear-cut solutions that are showing up in the research. Here at Progressive Medical, we get to be part of that data collection, working with labs from the Netherlands, working with regenerative farming techniques, organic sourcing of ingredients in our own backyard to really make sure that we have answers, that we're not hanging in this doom and gloom. We're exposed to everything. Oh, well, I guess there's nothing I can do about it.
Well, it's interesting you say that, because it's easy to be overwhelmed. If you're listening to Rethink My Health and you're saying, oh my gosh, I can't believe it. Now I got to worry about microplastics, swallowing a credit card every single week. That's just insanity. I'm just not going to even worry about it. Well, let me just assure you that there is hope. There is other options. Don't put your head in the sand, because ultimately the outcome cannot be favorable. Really, the goal is to become a very good detoxifier. And at the beginning of the show, Dr. Burdett talked a little bit about you can have two individuals in the same house. One responds differently. And that has a lot to do how the body processes chemicals and how the body eliminates those toxicities. And toxicity, even though it's an all-time high right now, your body's a sponge, and that when you can do certain things to get that sponge and eliminate the toxicity through lymphatic drainage, that's good walking. You can get something called a rebounder. So exercise, your movement, we've talked about this before, your movement is medicine to the body. But ultimately, one of the better strategies, and Dr. Burdett's talking about binding those microplastics with these probiotics, and that product that you're talking about, AB22 Bacillus, is fantastic. And that can make a huge impact. But once it's outside the gut and into the cell, we got to get that out of the cell and out of the bloodstream. And sometimes when it goes out of the bloodstream, it goes into the tissue. It can stay there for years and wreak havoc. And that's why strategies such as infrared or sauna has been heavily researched, and sweating. Dr. Burdett, we only got a few minutes before the break. We're going to be tacking on glyphosate on the next segment. But I want to talk a little bit about, we mentioned water filters, air purifiers. Here's a big one that most individuals do not heat your plastic containers. If possible, get rid of the plastic containers and use glass. But it's something as simple as that, especially in a microwave. Oh my gosh.
Yes.
It's horrible.
A few basic things that we can all do to help clean up and decrease our exposure to microplastics. Do not microwave in plastic. Please try to not let your food or your water get warm in that plastic. That is really one of the times it leaches the most out. Try to move towards glass. Watch out for chewing gum. It turns out chewing gum has a lot of microplastics in it. So be careful if you're a chronic gum chewer. Maybe think about switching over to some other kind kind of lozenge or whatnot. And yoga pants, ladies. And I love to live in my yoga pants too, but we need to start looking for fabrics that don't contain microplastics. Those better brands will talk to you about that. And so those are some basic things we can do to clean up.
Organic cotton is probably the way to go.
Organic
I know it's
cotton.
difficult. Definitely choosing organic support and detox, fiber, hydration, cruciferous vegetables. A lot of people don't realize that cruciferous vegetables make a huge impact. And sweating, your sweat is probably the most important things. Very, very quickly, Dr. Burdett, biggest hidden sources. You mentioned something I didn't even know about the pants. Anything else that you researched?
Yoga pants are not great. And the chewing gum, I think that's one people are just really aren't familiar with. But to your point, as you said, it's the water, it's the air, it's our food supply. So we need to be proactive. If you're sitting out there and maybe thinking about expanding your family or starting a family, this would be a great time to run through a
And
course
we've seen infertility,
of
all-time high
Yeah,
infertility.
absolutely.
And we're not saying it's microplastics. I think it's the environment in general. It's just one of the things. These are endocrine disruptors, and we're seeing all-time high. A lot of women are not been able to get pregnant, of course, and that's really a concern. So if you're out there beginning to start a family, definitely consider a very extensive detoxification. Always look for an expert integrative practitioner that's trained, that can guide you. I think it's very important. This is really interesting stuff, Dr. Burdett.
Yes,
We
it
really
is.
appreciate that. Hey, this is Rethink My Health podcast here about educating, getting to the root cause. We're talking about toxicity, microplastics. When we get back after this break, we're going to be tackling glyphosate, and we're going to be talking about how this particular herbicide that has been used extensively to farmers has really a major impact potentially on our health. And we have to really do a good job in finding it and dealing with it because we're seeing a lot of ramifications. Back in a moment. Welcome back. Rethink My Health. This is our second segment, tackling toxicity, microplastics. Before we get on to Roundup and glyphosate, Dr. Burdett, you were mentioned to me during the break about some of the research you found out with how microplastics are affecting babies, that when their sexual development is being compromised, which
Absolutely.
is interesting.
It really is. And I don't want to scare the listener, but we're here for education. And again, we're coming with solutions as well. So if you're in that position, getting ready to family plan or add a new family member, think about using something like a course of microplastics and a course of glyphosate just to clean it out of your body first. The reason for that is there is some research that's showing different changes in sexuality in even like genitalia when babies come out that are higher in microplastics. And so they do various measurements and look at what's going on. And there's, normal standards. And then you see more deviation when there's higher microplastic exposure in the kiddo. So yes.
That makes kind of sense because it is an endocrine disruptor. And when you're having a baby and the baby is relying on you for development, obviously this toxicity is going to affect. And we've seen this plethora of studies that talk about the umbilical cord has, oh my gosh, like hundreds of different chemicals by the time. So caution. This is a big problem, and hopefully our scientists and our medical community gets behind this, and this is not going to be discredited because some industry wants to keep plastics. And certainly we know that plastics are here to stay. We're talking about now strategies to minimize the effects that we're seeing right now. And really, you can control your environment. You can use some of these strategies, and you have to make this investment of time and energy and resources because it's going to affect your health somewhere down the line. And hopefully we can get a hold of this quickly and get the proper testing and take a next level. Okay, Dr. Burdett.
The Netflix is worth watching because they track 6 couples that are trying to conceive and they can't conceive. And then they work with those 6 couples to get microplastics out, and they all end up conceiving after that. And of course, that's not a huge, robust study. But again, it points in this direction. And, maybe you're not trying to conceive. Maybe you're perimenopausal. Maybe you're in your 40s. Maybe you're postmenopausal in your 50s. But it turns out throughout perimenopausal, postmenopausal, we still have small circulating levels of hormones. And so a lot of people out there think, oh, I need to be on hormone therapy, or I need this estrogen, or I need this progesterone. You might not. You might just need to detox the microplastics and glyphosate that are in you, because those are disrupting what you have.
Absolutely. And listen, over the past 30 plus years, I never thought I'd be talking about microplastics, but the bottom line is I've always been talking about toxicity and chemicals, and every single young aspiring family and husband and wife coming in talking about planning for children. I've always told them the best thing you can possibly do is not only have good levels of nutrition, but get on a systemic detox, become a really good detoxifier before you get pregnant. Now, once you're pregnant, you cannot detoxify.
Right.
You detoxify anyway, but you don't want to be in a program.
Right.
And it's very interesting. Okay, let's really get on to the next topic right now, because I do believe there's crossover with microplastics. And I want to talk about an herbicide. And now herbicides have been used for several decades for farmers. And it's used to help with pest control and to help these farmers as well. So obviously there was very, very good intention. However, we've seen major problems right now with glyphosate, and it's detected in now 60 to 80% of urine samples in the United States. And the World Health Organization has classified this substance as a probable carcinogen. So that is a big issue. It's linked to microbiome disruption, hormone disruption, and possible cancer association. Right now, there's class action suits everywhere because they've linked definitively non-Hodgkin's lymphoma. As a matter of fact, we just saw a young man, Dr. Bouquet, and his medical team that looks at integrative oncology, just recently diagnosed a man and sent him to an oncologist to confirm the diagnosis. He is 28 and he's got stage 4 non-Hodgkin's, and he owns a company that uses Roundup, landscaping company, and he was using it quite extensively. And that's a clear sign, obviously. This is a problem. Dr. Burdett, the research you've done, what have you been finding out? I know you've done some research on this. Let's take a step back for a second. Originally, this was used for farmers because of pest control. I understand that as well. Now we're seeing regenerative farmers making a comeback, organic farmers. But I think the damage has also been done a lot because they've been using this on wheat. I know Dr. Alicia Fasano, talks a lot about that. They're coating this onto the seed, and now we're seeing this ingested into our foods. Give us your opinion. Is this a big problem right now?
Well, Europe says it is. It's not even allowed to be used there anymore. And so we're just a little bit slower with these things in the States. In addition to that, there was a large class action suit that did say glyphosate caused cancer, and there were payouts for that. So you have to have a pretty high standard of evidence for something like that to go in favor in terms of protecting our citizens from this. And so the original thought with this glyphosate, this pesticide, was that, it would be great. It would only affect enzymes that were in plants, and humans wouldn't be affected. And that's just a real interesting kind of idea right off the bat. We're going to put a toxin on plants that we eat, and somehow it's not going to affect us. And so that was wrong on multiple fronts. And so first of all, even if you say, well, it doesn't affect human enzymes that much, but I'll get to that in a second. What it did affect were the enzymes in that flora, that good, healthy microbiome. And again, our microbiome keeps us from having autoimmune conditions. It's one of the major drivers of our immune system, not just in the gut, but in the rest of our body as well. It actually helps us make various neurotransmitters that communicate with our brain. And that's before we even talk about absorption of nutrients. So glyphosate kills off the good, healthy flora in our gut. And there is association with more, again, irritable bowel disease because of glyphosate. But then from there, glyphosate also blocks a certain part of nutrition. It's called a thiol group. Name's not important, but that is necessary to build the major intercellular antioxidant in all of our tissue. The major antioxidant is glutathione, and that's in our brain, that's in our lungs, that's in our kidney, that's in our liver. And this glyphosate blocks your ability for the body to make the major antioxidant that we rely upon. Then from there, we were wrong. It does go through the liver. It does affect enzymes in the liver. And the ones that it tends to affect the most are the ones that help us to take our hormones and make them into a form that's not even, that's non-cancerous, but's even protective. So when we look at estrogens, they get metabolized. And some of these metabolites are protective and keep us from getting cancer. And some of those metabolites promote cancer. And it turns out that glyphosate turns on those enzymes, those genes in the liver that tell us to make more dangerous estrogen metabolites. So we measure this here at Progressive routinely. We do urine metabolites on hormone tests. We look at how our women are metabolizing their estrogen before we put them on this, because we know it's a big deal. You can take that same estrogen and your liver can turn it into something that protects you or into something that harms you. And so we can measure these pathways, and we know there are compounds from broccoli that can help with how you metabolism, or even from turmeric. But sometimes here we'll see we just can't get that estrogen metabolism to go the direction we'd want it to go. Well, another factor is that there's consumption of glyphosate, and that glyphosate causes you to produce estrogen or produce estrogen metabolites that are very negative. And men, you're not off the hook with this, because it turns out that those damaging estrogen metabolites you make as well, and your prostate is very sensitive to it. And so in terms of reducing prostate cancer, it's not just about testosterone. Really, these estrogen metabolites might be more at play, toxins might be more at play. And so if we can't switch what the liver's doing, it's likely not your genetics, not your fault. It's the glyphosate that's causing your liver to do that in the wrong direction. So it's a big deal.
It's a big deal. And thanks for sharing that. And once again, we're not here to alarm you. We're here to bring awareness to this problem right now. This is a huge problem right now we're seeing in our environment. Unfortunately, sometimes it could be too late because we have a lot of work to do. It's more than just becoming organic right now. Glyphosate has actually been prevalent everywhere. So what do we do right now? So let's take a step back. Endocrine disruptor, turning off the genes in the liver, affecting the antioxidant glutathione. So we don't want you to run to the store and get glutathione. Here's what I want you to do is talk to your practitioner. Find out if you're suffering with a autoimmune disease, if you have cancer, if you have any type of other disease. As a matter of fact, there was a recent study that they were looking, and they did this with rats, and they found that glyphosate induced neuroinflammation and like an Alzheimer's-like changes. And this is research they've done over the past 5-10 years. So now we're seeing that component passing the blood-brain barrier, causing this neuroinflammation. And there's many factors as well. The goal is, how do we get this out of the body? So I want to spend a little time about that, Dr. Burdett. There isn't really good testing yet. But I think there's some markers right now, like C-reactive protein, if that's elevated. If you see something like 8-OHDG, which is hydroxydeguanosine, which is also another marker for free radical damage, oxidative stress. This is what a functional practitioner. So that's kind of a raising alarm right there. You got to almost assume it could be from this, as well as possibly other environmental toxicants. Is there any testing right now that you know of that can measure this?
So not directly, but indirectly. And that's one of the things that we do here at Progressive Medical. We look at markers of oxidative stress. And so like I mentioned, glyphosate will block our ability to make one of our major intercellular antioxidants that keeps us young, that keeps our brain young, that keeps our organs young. And so we measure that here at Progressive. We look at levels of glutathione, and we are very good at therapies that increase glutathione. We even have IV therapies that can do this. But now and again, you will find that patient, and no matter what you do, you just can't get their glutathione up with things that build the molecule. Well, now we know it might not just be the precursors for building, but it also might be glyphosate blocking your ability to incorporate these things and get it into a cell. So now we have additional mechanisms and things to turn to. If we see glutathione that just will not improve, we need to think about glyphosate. Also, on that same test, there's something that goes up when there's more damage to the DNA. And so think back to 9th grade cell biology. You know what that means. Damage to the DNA is a mutation, and mutations increase your risk of cancer. So it turns out that as we detox glyphosate, we get rid of this thing that damages the DNA. Now, we can measure that. There's something called 8-OHDG. It's a funky name, but that goes up when there's more damage to your DNA. So if you're sitting out there wondering, oh my gosh, on one hand, there's all these things in the environment. On the other hand, how affected am I? We have a way of looking at that for you, and that is our oxidative stress test. When those markers change, when they're out of normal range, we can say, yep, your body's at toxic threshold. You've got too much. You've got so much. You're depleting your antioxidants. You're damaging your DNA. And now we know, okay, let's do a guided detoxification. Let's use glyphosate. Let's use microplastics. And you can find those at Progressive NutriCare. Let's run you through a course of those and then watch your markers come down. But even if you're not doing testing, reach out to us, because these are good preventatives. Like I mentioned, if you are having any kind of hormonal issues or just feeling tired, maybe some gut issues, all of those things can be affected by toxicity. Run yourself through a course of these things, get them out of your body, and you're going to reduce your risk in the future of autoimmune conditions or cognitive decline, or even it's going to be helpful in terms of cancer prevention as well.
That's very fascinating. And you're right. There isn't really a good test to measure this yet. Hopefully,
we're working on it.
We can get some scientists behind this and do some R&D. But really, there are some indirect markers, as you mentioned, which is very, very important to find out. But there's definitely common denominators, and we know that it's contributing to chronic diseases. I mentioned earlier, not here to be an alarmist. We're here to bring awareness so you can take action. Okay, I want to say a little bit about how do we, now that we know that glyphosate is actually a potential problem, even to the point where some patients will get cancer, which is very, very unfortunate. Let's talk about some of the therapies. We know that detox is important. I want to spend a little time talking about these binders. You mentioned glutathione, bile support. Any other treatments that you know of that can reduce the toxic burden of glyphosate, and how we can kind of tie this in all together? Because there's definitely crossover with microplastics and obviously glyphosate. Obviously, the number one thing is to eat organic when possible. I think that's very, very important. Can you educate our viewers and listeners on some of the top foods that you have researched, and then we'll get into the detox?
Okay, yeah. So in terms of foods that are going to be your biggest culprits, I would suggest people go look up something. This is something we arm all of our patients with, a list called the Dirty Dozen and the Clean 15. And so the Dirty Dozen tend to be lovely things that we like, that our kids like. Things like grapes and blueberries are really high on that list. Strawberries in terms of the Dirty Dozen. And so these are times you need to be really on point with making organic choices, or if you can't, at least coming home and doing a vinegar water soak to pull as much of that off as possible. And then go look at the Clean 15. These are places where if you can't buy organic all the time, they tend to have less exposure. So go read that list, learn that list. The Clean 15 tend to be things that have harder skins on them, like cantaloupe or avocado. Pesticides just can't get in as much. So that's a great starting place. And that's just something that we should all have familiarity familiarity with, looking at those foods. From there, in terms of what you mentioned, you said we got to figure out how to detox right down to a cellular level. So our microplastics solution called Microplastics has something in it, a melon concentrate. And that melon concentrate has something called superoxide dismutase. And that, again, is a long name, but it is an antioxidant system that works with inside the cell to help you detox on a cellular level. And so you see that in your microplastics, and you also see that with a type of mushroom, an oyster mushroom. And this is really interesting because, for example, if we look at just oysters in general out in the ocean, we know they concentrate a lot of microplastics. And so it's driven coastal areas to try to figure out how to clean up the water, because if they don't clean up the water, you're going to have these oysters that are just loaded with microplastics. And so when you look at the oyster, there are reasons that it captures these microplastics and takes them in. There's a similar mechanism of action for oyster mushrooms, which you'll see in the microplastic product, because that allows you to capture these microplastics, sequester them, and move them out of the system. So it's really fascinating, the crossover you see.
That is a fantastic strategy, Dr. Burdett, and that's why I know you working with Kingdom Health Sciences and their R&D department are looking for real solutions for microplastics and glyphosate, which is a big problem. And you know, I think one of the most important things here is that the take-home message that we're going to be talking about to not only you, our listeners, but we're educating practitioners all over the country. We're educators. We're here not to be alarmist. We're here to have solutions. We're here to be a positive influence on you make proper decisions. You know, family care practitioners are just too busy to talk about this. They're not going to focus on some of the research. Functional doctors are fascinated by this, and we're going to continue pushing the envelope. We're going to continue looking at status quo, because status quo got us into an all-time high right now with chronic diseases. There's a reason why Americans right now are not trusting the traditional healthcare system, and we're hoping to get that trust back, but it's going to take more research and effort. And it really talks about you taking responsibility for yourself and your family. You're responsible for your temple. Use professionals. In an emergency situation, obviously, you need to do what's necessary in an acute situation. But for chronic diseases, we need better strategies. Now, are we going to sit there and say everything's caused by microplastics? Absolutely not. Everything's caused by glyphosate? Absolutely not. But what we are going to say is this: toxicity does affect the body's ability to function properly at the cellular level. I want you to start thinking at the cell. The human body has 30 trillion plus cells. That's a lot of cells. We're nothing but cells. And that's why I go back to cell biology. Every practitioner that went to medical school or studied this, they talk about the cell. Okay, second year medical school, even first year medical school, we talk about this, and it's so important to look and think about the cell. And these markers that Dr. Burdett mentioned earlier that you can get from a functional practitioner are very important because they can raise the alarm. You may be a great detoxifier. You may not be. So it's really important to do that. So let's continue now with this detoxification message, Dr. Burdett, because I think it's so important. We gave some strategies. Some of the things that I've researched when it comes to glyphosate as well, is that not only is it contributing to what you mentioned, that's blocking these pathways, turning on these genes when it comes to estrogens and when it comes to other hormones as well, and cancer. It's affecting P53 gene that we know that's the anti-tumor gene. But we know that some of the most powerful ways is to repair the microbiome, because clearly glyphosate has destroyed it. Okay. And we're seeing that very prevalent right now. Any nutrient that you know of besides what you've just mentioned when it comes to the microbiome? I've read a little bit about BPC 157 as well, hope to tight junction, but does that get rid of glyphosate.
Yeah, and so that same bacteria that I mentioned, the Bacillus subtilis AB22, not only helps with microplastics, but helps with glyphosate as well. Now, many people might say, well, doesn't that just exist in the gut? And so, yes, they can understand how that would decrease absorption of the chemical, but once it's in the body, does it truly get it out? And here is just a study that I found fascinating. They took mice and they wiped out their healthy flora in the gut. And then they looked at their liver enzymes where detoxification happens. Those detoxification enzymes all went down. They went more silent. Then they put these species of flora back into the mouse, and what they saw was that their liver detox function got better. Why would that be the case? Well, it turns out these bacteria, like I was mentioning, they make peptides, and we absorb those peptides that send signals to the liver. In this case, it's called an aryl hydrocarbon. Again, the name's not important, but we've always known that what happens in the gut doesn't just stay in the gut. So yes, these species block your absorption of glyphosate. Yes, they can pull it into the cell wall and protect us, but they also send a signal to your liver to work on things that have gotten into the body. So really harnessing the power of these unique flora and using them to protect us and detox us is something that hasn't been done, hasn't been studied. And I just feel so blessed to be at Progressive, where we get to work with these things that are cutting edge, where people in the community come to us for research and development because they know and they trust the outcomes here, and they know that we're on the side of moving integrative medicine forward.
Absolutely agree with you. Moving integrative medicine forward is very important. Hey, if you're listening to Rethink My Health for the first time or watching us on this podcast and radio show, we're so excited that you're here, and we thank you. We're tackling on subjects that most practitioners in traditional medicine will not even talk about. If you're overwhelmed right now because, oh my gosh, here we go, another microplastics and glyphosate, we can make it very simple. The most powerful steps you can do is have your body become a better detoxifier by reducing exposure. So what does that mean? The dirty dozen, get them out of your diet. The clean 15, absolutely take a hard look at that. Look organic when possible. I know that there's an expense there. I know that sometimes we're stretched right now in our society, but your health is worth it. Do the best you can, strategize, and become a better detoxifier. Take a leap of faith and do more testing on yourself. Find an integrated practitioner. Hey, Dr. Burdett, this has been a very informative podcast and radio show. Any last words of wisdom for our viewers and listeners to take action?
Well, like I said, I'm so privileged to be a part of the solution. Yes, we need to understand the problem, but it's one that's fixable. If your immune system has been too excited, if it's a runaway train, you don't need to be on immune suppressants. You need to figure out what the irritant is, and then you need to find a solution to get rid of it.
Thank you, Dr. Cheryl Burdett. Fantastic. What a great educator. I can listen to her all day. Okay, Rethink My Health podcast, a very exciting show. Tune in each week, and we're going to be talking and tackling more about chronic disease. And remember, a cheerful heart is good medicine, but a crushed spirit dries the bone. God bless you guys, and be cheerful, and see you next time on Rethink My Health.